after researching the huge impact that alcohol has had on the LGBT community, DrinkCoach has decided it was important to raise awareness this Pride Month. Today, we'll be talking to Rob Wilson, founder of Angels of Freedom, to discuss his experiences with alcohol in the LGBT community, barriers to accessing support, and the importance of early intervention. Differences, if any, do you see in drinking patterns among the LGBT plus community?
The LGBT community compared to mainstream community, there's a lot more dependence on alcohol around socialising and networking and that sense of belonging to a wider community.
Prompted you to set up the Angels of Freedom in Leeds, and what impact has it had on the local LGBT community?
There's a lot of the risk and vulnerability that there is within the community and the high level of dependency that there is on the bar scene as being a way to connect with others. So the Angels of Freedom, one of the activities we do is about that face-to-face direct engagement and support.
What were the challenges you faced when you decided to stop drinking?
It's a bit of a funny one when it comes to being around people who are used to you being a certain way. I'd be the one at the bar buying the extra round of Jaeger bombs, so going from that relationship with people and those connections with people to not drinking at all, it's quite uncomfortable for other people as well as for yourself. I heard a lot during those early days from those people, just have one, or, it always kind of, how long are you going to be keeping this up for? As if it was an inconvenience to them, rather than something that I was dealing with and that I was going through.
You would think that people would be supportive, because it's a positive thing.
Absolutely. You would think people would support you because it is about your own well-being and your health, the decisions that you make around your alcohol consumption. As someone who isn't currently drinking, my message very loud and clear that I say to people is, it's not about abstaining. It's not about me telling you that you have to stop, but it's just about you making conscious decisions and staying safe.
What advice would you have for anyone who is worried their drinking might be becoming a problem?
If someone is concerned about their alcohol consumption, I think they probably want to have quite a closer look at what alcohol they are drinking and any reasons that they have drinking. Whether it's them trying to deal with the situation that they're in, or whether it is about the social aspect of it and what they actually get from that social interaction.
I saw some quite horrendous quotes of people in the LGBT community and the experience that they've had when seeking healthcare. What barriers are there for people in the LGBT community seeking help for their drinking?
Often, people within the community can be concerned that a service won't understand them, won't understand their needs, will make assumptions about lifestyle, and that can really put people off standing. That's really critical for people in the community to know that actually they do understand it from my perspective. They haven't made assumptions, that it's some of that messaging that goes beyond just flying a rainbow flag.
The DrinkCoach offers one-to-one online coaching sessions with an alcohol specialist. All of our coaches have a profile on our website, so you can choose who you feel you connect with the most. So how would the DrinkCoach online coaching sessions benefit the LGBT community?
DrinkCoach online sessions, the fact that they're online is really helpful, so people can choose where they are to engage with those sessions, so they can be in a safe place themselves or be around other people that will support them. I would imagine that it's an environment that's free from discrimination. The focus that's there on supporting different people within the community and it being tailored to that individual, which is a really important aspect as well, and being able to gain that support in a way that works for that individual rather than it being kind of a set program that people follow.